Hi, I'm Dr. Toll with Tier 1 Education. When examining someone who has complaints of hip pain, specifically groin and buttock pain, we're very often thorough with our hip examination, but we do want to rule out another condition that is sometimes present and can mimic a intra-articular hip problem. That mimicking problem is called thoracolumbar junction syndrome, and it does have a referral pattern that goes to the buttock, the PSIS area, the lateral hip, and then even sometimes in the groin as well. So let's review kind of how we can provoke or at least screen out for thoracolumbar junction syndrome. So for assessing thoracolumbar junction syndrome, we can use a couple different assessment options. We can use central and unilateral PAs. So if we were to count up to approximately the 12th thoracic vertebra, we can apply pressure and see if that reproduces familiar symptoms to the PSIS area or slightly below. Does it travel along about the 12th rib and go to the lateral side of the hip, or does it go into the groin? So central PAs from probably about T12 to L1 should be sufficient to rule out the thoracolumbar spine. Also a unilateral PA, so going off just to the side over the transverse process and applying a pressure. And again, seeing, do we see that familiar referral pattern that they're coming in with, lateral hip, PSIS, or groin pain. And then the last test is a skin rolling test. And with this test, you're looking to pinch the skin and roll down in a way to, again, provoke that familiar buttock or groin pain. So it's pinching the skin and rolling down. And again, looking to see, does it reproduce familiar symptoms.